Greetings and good day. My name is Shina and this presentation is titled A Review on Absorption Spectroscopy and Laser Speckle Techniques for Wound Healing Assessment. This work is also authored by Dr. Audrey Wong and Dr. Xavier Ngu from the Faculty of Electrical and Electronic Engineering, UTHM. Before we proceed further, allow me to briefly explain about wounds. A specific definition of wound would be a disruption of the anatomic structure and functionality of the skin tissue caused by an injury inflicted on the skin barrier. In general, wounds are commonly categorized into either acute or chronic wound, depending on the appearance and severity of the wound, and the recovery rate of which the anatomical structure of the wounded tissue is eventually restored. An injury that only affects the superficial skin surface and known to heal within a timely and orderly period is described as an acute wound. Contrary to this, the healing rate of chronic wound is unpredictable. The causes of a chronic wound are due to a more complex pathology, hence the inability to establish full recovery of the tissue structure. To that, several techniques have been introduced to monitor healing progress. Visual inspection of physical appearance of wound is one of the commonly practiced ways of evaluating wound. However, assessments are made based on the width and depth of the wound but did not take into account the underlying histological aspects. A more objective approach of wound healing assessment, however, is by means of an invasive method which required biopsies of tissue sample. Proper understanding of various processes involved during wound healing progression is crucial in order to distinguish clinical parameters suitably used as guides for proper clinical diagnosis and therapeutic measures. The aim of this work is to summarize the use of spectroscopy and laser speckle techniques for effective wound healing management and to discover potential fields for future laboratory and clinical research. Mean blood oxygen saturation, SO2, is commonly used for quantitative analysis of wound healing status. Scientific studies revealed a strong correlation between local oxygen consumption and tissue oxygen saturation during post-operative assessment of skin graft. Oxygen is necessary for optimal repair of new tissue cells and production of collagen by fibroblasts. In addition to this, oxygen is also essential to build up body's immune system against bacteria by neutrophil production. Poor oxygen delivery would hinder collagen distribution and, consequently, promoting bacterial proliferation, which leads to the formation of necrotic tissue and eschar on wound bed. Besides tissue oxygenation status, continuous blood flow perfusion is important to guarantee consistent delivery of oxygen, nutrients to the wounded skin site. Blood flow perfusion is listed as one of the reliable biomarkers to map microcirculatory changes and to identify abnormal histopathological changes in the body. Several methods have been introduced to accurately assess wound healing progress. One of the commonly practiced methods is the absorption spectroscopy technique. Spectroscopic imaging is a unique technology that enables detection of light intensity across the spatial and spectrum directions at chromatic resolution not visible to the human eyes. The basis of the visible reflectance spectroscopy technique depends on a priori knowledge of absorbing constituents in epidermal and dermal layers. As a matter of fact, this concept is applied in major research of skin oximetry, taking into account the changes in light intensity depending on the absorptivities of two major hemoglobin derivatives present, namely deoxyhemoglobin and oxyhemoglobin. Shown here in this figure is the absorption spectroscopy properties of hemoglobin derivatives. The information on absorption and scattering properties of skin tissue can be deduced from light signals reflected from the particular skin site. The SO2 is defined as the blood oxygen saturation value or fractional concentration of oxyhemoglobin with respect to the total hemoglobin concentration. The detection of light intensity reflected from a surface can be done using a CMOS or a CCD camera. One such example is using the hyperspectral camera. This device can capture image across a series of wavelengths with fast scanning rate, thus allowing a large quantity of intensity data to be measured over a short amount of time. The application of the hyperspectral imaging system range from agricultural and food processing to pharmaceutical and medical image processing. Novel medical findings revealed the use of hyperspectral imaging tool to investigate HbO2 level of infected food among the patients with diabetic foot ulcer and to study the severity of PVD, peripheral vascular disease. A multispectral imaging system, although similar to the hyperspectral imaging system, differs in terms of sampling number of data. This system captures image at a relatively narrow and discrete band of not more than 20 bands in each pixel. Thus, a shorter computational time is required for the analysis of multispectral datasets. Some of the notable achievements of this technique include tumor detection and burn wound assessment. In a recent work, Paul conducted a clinical investigation among human subjects with superficial wounds at different skin locations using STO2 as a marker to predict wound recovery status. The corresponding work concluded a high SO2 of approximately 60% is necessary to ensure positive and timely healing. Meanwhile, laser spectral imaging is a technique that has advanced over recent years, and it is widely applied in various medical researches. The primary foundation of the laser spectral technique relies on the interference patterns of reflected and scattered light from an illuminating surface. Observations on the speckled pattern of the emitted light showed correlation between displacement of an object and the pattern. This is in such a way that the speckle contrast can be translated into blood flow. A reduced contrast is to be found in regions of high blood flow, and a more enhanced contrast when blood flow is restricted. From this review, it can be summarized that the development of a multimodal wound imaging system would prove to be of added value to both patients and medical practitioners. Early identification of factors impeding chronic non-healing wounds would allow appropriate medical decisions to be made. The development in this research could provide an effective solution for clinical practitioners to come up with proper diagnosis with respect to different prescribed treatment. Finally, we would like to acknowledge the Ministry of Education Malaysia Undergrant FRGS Board number 1581 and University Tun Hussein On Malaysia Undergrant GPPS for financially supporting this work. We have finally reached the end of the presentation. Thank you very much for your kind attention.